Want to join us. I would like to do formal attendance just to get in the habit of doing that. I know we didn't at our last meeting, but I think worth having kind of a formal record of that, especially as we move into meetings where we may have votes, just so we can kind of formally ensure that we have quorum. We may be a little close at the moment, but I'll start by just going through and calling names, and if members can just say here when they hear their name, please. Kevin Lewis.
Here.
Trevor will be right back. Trish Riley.
Here.
Jeff Sanford.
Here.
Ann Graham. I saw Ann join. Ann Graham, are you able to just confirm your attendance?
Yep, I'm here. Thank you.
Great, thank you. Katie Fulham Harris. Katie, mind coming off mute and just confirming you're on?
Sorry, I am here. Yes, thank you.
Mallory Shaughnessy. I don't think that I saw Mallory join. Okay. Kate Endy. Okay, I see you raise your hand, Kate. We will take that as a affirmative. Jordan Rhodes.
Here.
Heather Perot. Thank you. Trevor Pataki. Great. I was just saying we'll try to get in the habit of formal attendance. I'm just double checking because I think we may just have a quorum of voting members. Yep, we've got 7, which constitutes a quorum. I know Dr. Renee Fay LeBlanc, Mallory Shaughnessy and Christy Daggett had let me know, or sorry, excuse me, Carl Tony and Christy Daggett had let me know they weren't able to make it this morning, and then it looks like Mallory wasn't able to join us. But we've got the 7 members that we need for business, which is good news. A little bit of a different setup here with so many folks on the remote meeting. So I think maybe if we can just use a process of hand raising, that would be helpful to me. I'm already managing a couple different screens, so that will make it a little bit easier for me to call on folks who are joining remotely if they do want to chime in. So I'm going to go ahead. Oh, sorry, Kate, I see you raising your hand and I didn't promote you. I'm going to make you a presenter right now. Should be all set now, and I'm just doing one more scan through to make sure that I've got everybody who is a council member.
Thanks so much.
Thank you. Sorry about that, Kate. I saw you join, but I missed that step. Perfect. So in that case, I will jump right into the slide deck that I have prepared in our agenda for today. As I noted in a note to council members, I think today will be a more discussion based than our first meeting. You know, I don't have such a long presentation and a lot of data to go through. I'm really hoping to accomplish some of the sort of administrative operational steps that we need to formally gather as a council and take care of some of those. And then, as we discussed in the last meeting, talk a little bit about these 2 special meetings that we have coming up in the fall, and a little bit about planning for those and a chance to solicit some feedback. So I won't re-summarize the agenda. Again, we'll see. I wanted, as I said, to leave lots of time for discussion, so we may move through it more quickly, but I assume no one will mind getting a little extra time back. So to start off, I wanted to give some updates on administrative items and operations of the office. One very big development is we had noted we had a request in the change package that was passed by the legislature to increase all other funding for the office, meaning funding for basically expenses other than state line personnel. Very grateful and thankful to the legislature for supporting that and increasing funding by about $146,000 for the office. The main components of that funding increase are some additional funding for analytics contracts, something I think will be important in the months ahead to be able to seek out some additional external help given some of the limited staffing of the office. some funding for fellows and compensation to those fellows. I think that that will be a great benefit to the office to be able to have MPH students or other graduate level students or young professionals join us on a temporary basis to contribute to the work, and want to make sure that we're in a position to compensate them fairly. And then the other sort of big bucket was being able to pay the fees that we need in order to have legal counsel through the Office of the Attorney General. We do have access there, but it's a little bit like a retainer type of structure. So that was something that hadn't been, I don't think, considered in the original budget. It is important to us on an ongoing basis to have access to that when we need it. The other component of the change request was that change in the staffing authorization to switch an office specialist 2 position to a planner 2 position, which is a little bit more policy focused, analytics focused, rather than purely administrative. That actually generated a little bit of savings because the compensation level for that role is slightly lower, but in the same ballpark. On the hiring front, unfortunately, we are still awaiting the approval of the FJA for our public service coordinator to that senior analyst role that I described at the last meeting. I'm hoping to have that maybe sometime in the next month or so, and to be able to get hiring for that in the fall. But it is still, awaiting that process, so sort of out of my hands until I get that back in terms of being able to post it. And then I think we're right at the finish line in terms of having a delivery order for temporary staffing, so we can post for that first round of fellows. So tentatively, I'm just waiting on confirmation actually that that's all set to go right now, and hope to post those right at the beginning of September and capture students kind of coming back to school. I envision those probably being remote positions that could be part-time and flexible around students' class schedules and things. So hoping that they'll pick those up and they don't need too much lead time, though I anticipate maybe a little bit more success recruiting for that in the summer when lots of students are looking for internships. Finally, the website's a little behind where I'd hoped to be. Was hoping that would be finished in July, but got a little sort of tripped up over end of the year financial pieces and at the end of the fiscal year. But that contract is completely signed now, and it's actually under development. We have our URL secured, so you can go ahead and bookmark that now if you want to. It'll be maine.gov/OAHC for Office of Affordable Healthcare. Any questions on those items? Also wanted to provide a brief update on legislative items, since, as we know, the legislature was still going strong last time we got together. The big updates are a few of those task force study type bills that were pending decisions around funding have a resolution now. So the first, the Rural Health Task Force, which the Office of Affordable Healthcare had been charged with fully administering and staffing, was carried over from the special appropriations table. So that will not be a requirement or an activity we need to be pursuing over the course of this fall. The Facility Fee Task Force, which was a bill that sort of came out of a facility fee regulation bill that was turned into more of a study and task force model, was enacted and funded. That's being organized by the Legislative Counsel Office. So I did reach out to them. My office is or my position is a non-voting member of that group, and the office is charged with providing staff support as needed. This is an issue I've worked a bit on and am familiar with, so I did proactively say, we're here to help. I'm happy to be involved in the planning for that, but I think they're in the process of thinking about appointing members to that at the moment. And then finally, the Blue Ribbon Commission on Guaranteed Healthcare did die on the special study table. So from my understanding of the legislature, I don't think that's carried over to the next session. The final items, I won't go through in too much detail. Those we had discussed, and they were already fully passed and enacted at our last meeting, but a couple tweaks. One to the study bill that my office will be delivering in January, and another that made a minor change, a slight change to the mission of the office to ensure that an eye towards new technology and the costs and savings associated with that are included in the mandate of the office. Any questions there? Great. So moving on to council business, some of our exciting work to do together. I wanted to start, just so that we have it done at the beginning of the meeting, with the election of a chair and a vice chair. I received just one nomination for each position. So Trevor Benaki was nominated for chair, and Kate Endy was nominated to serve as vice chair. I will pause there and ask if there's any discussion that folks want to have, if there are additional nominations that anyone would like to raise before we ask someone to request a formal vote on that election. Sounds good. So I think as a non-voting member, I can't move to sort of call the vote. So would any of the voting members like to request a vote on that? And could somebody line up to second the request, please?
I move we elect the slate of Trevor and Kate.
I'll second
Should we go through and do a roll call vote, or are folks comfortable with saying that that's a unanimous decision? Okay, we will mark it down as such. Congratulations. Excited to work with both of you, and really excited to kind of have the formal means of the council and the office kind of interacting and collaborating on these agendas. I know I've been sort of dictating the agendas and what we're talking about in these meetings, but as you'll see as we move on, excited to have more of a back and forth on that. So great, making it easy. The next item that I had here for discussion, if needed, or potentially a vote today, is the remote meeting policy for the office. Public bodies are required to have a remote meeting policy like this in order to facilitate remote participation. I took and combined a few different remote meeting policies from other offices. A lot of them are very consistent. I will say the one place where I saw some differences is that some are extremely specific about what distance means. You know, you need to be on an island without a bridge or 100 miles away. I used a little bit more flexible language, which I saw in some other examples in terms of distance just being sort of a prohibition on attending in person. But this is something, yeah, that we sort of need to adopt in order to be fully in line with statute moving forward to host hybrid meetings. Is there any discussion or are there questions about that policy that anyone would like to ask? Not happy to have somebody move on a vote for that one as well. Yeah, Katie?
Sorry, Meg. I didn't see that you sent the policy out. Have we received it?
I think it was on the email that I sent last night, unless I left it off by mistake, but I believe that I included it. Did others see that?
Yes, I think it was.
Okay, I apologize. I was off today. I'm working today to join this, but so I didn't.
No
see it.
problem. Totally understand that, Katie. And let me know. I don't think there's, I'd like to get this done so that we're above board. But I think if we want to hold it for the next meeting, we could probably do that too. I don't think that's a problem. I'll look over at our public participants and others, but if folks want some extra time to take a look at it, I'm fine with that as well.
And I'm comfortable proceeding. I don't feel the need.
I'll move to accept the policy.
Great. Is there a second for that?
Yeah, I'll
motion?
second.
Great. And are we comfortable calling that unanimous? I want to call for a recorded vote on that one. Just trying to follow our Robert's rules here, make sure we're conducting things as we should. Great, wonderful. So that's a couple items that we can check off of our list. I included a couple other items here that I assumed we would want to discuss at this meeting and probably hold on action for potentially a little bit longer. The first is the conflict of interest form. I based this off of a version that Heather sent me. Thank you, Heather. That was used by the Prescription Drug Affordability Board. So just followed their structure, but subbed in the statutory requirements and definition of conflict of interest from the section of law establishing this council. I am comfortable. I understand from my reading that conflict of interest may have been part of the process when you were nominated for this council, and some of you may have more insight into the requirements there than I do. I wanted to offer up that if there is clarification needed, I will be honest, in reading, there are some different ways that these recusal requirements are structured for different boards and councils. So if we would like to take some time, if I should seek out any clarification, for example, for me, one thing that wasn't entirely clear is whether it was referring to recusal from the body or recusal from consideration of certain matters. But if that's something that's been discussed with as part of your nominations that members of the council feel comfortable with or aren't concerned with, you know, I'm happy to move forward with this form and send it out and get it signed, but just wanted to offer up that I'm I'm also happy to do a bit more legwork there if it's something that's helpful to the group.
I'm comfortable with it as it is,
Okay.
personally.
Maybe I will say, can raise your hand if you'd like to hold or have any more questions. Otherwise, we can assume we'll move forward with this form. Great, wonderful. I will, I did attach that. I can send it out one more time to the group after the meeting for signatures. I don't have a digital signature right now, so maybe we could plan to have folks sign and bring it with them to the next meeting, or if you want to scan a copy and send it over to me, whichever is easiest, and I can keep those on file for future. Great. Another item done. So that brings us to the council charter. This is certainly the most substantive of these documents, and I think probably warrants more conversation. I do have copies here in the room if you need one, Trevor, or if you've got one,
Okay.
but folks should have that in their email from yesterday as well. I really wrote this up myself as just a jumping off point. I looked at some similar charters for other ad hoc advisory groups within the state. And then I looked at some other examples from other entities, specifically because I think the advisory nature of this group is less common in the state government model. So I just pulled in kind of components that I liked, tried to think about what I thought might be helpful, kind of ground rules for conversation and participation. But I really see this as much more a vehicle for the group's thoughts about their work and you know, your charge and what you would like to have outlined. So really want to open this up for discussion today. And I think that this can be a work in progress. We can make edits and bring it back for further conversation at the next meeting and maybe adoption. But I will leave it there and am interested to hear if folks got a chance to take a look. If you have reactions or recommendations, thoughts for discussion with the group.
I thought that the charter was really good. I thought it covered the main areas you would want to cover in a charter. Granted, I don't have a ton of experience with charters. The only thing I thought might be worth considering is I know we all represent different stakeholder groups, but to the degree we can put our sort of professional hats aside and focus on you know, what's best for the state of Maine and the people of Maine. I thought that might be worth sort of noting in the charge and responsibilities section.
Yeah, I'm happy. I know I included a couple bullets sort of around what I hoped would be like unifying goals for the group
Yes,
that I hope
yes.
are high enough level and generalized enough that they could you know, be acceptable to all members. I can definitely add a bullet there, maybe that says something along the lines of making progress towards those two goals being, you know, the charge of the group as opposed to sort of representing interests of affiliated organizations, something along those lines.
Yeah, that'd be great.
I had a comment on the operations section. Might want to add a bullet that just talks about the group being able to form subcommittees as needed to address particular issues.
Will do.
Should there be anything in here about voting by email if needed, or some remote voting capability?
Yeah, are you thinking, I think in the remote meeting policy,
Okay.
there is a requirement that if we're holding a remote meeting, we conduct votes that everyone participating can see and hear. So my only concern would be, I think if it's email, it's
Yeah, that
not
might make it
visible
tough,
enough.
yeah.
So, yeah.
Okay.
Trish, I see that you have your hand raised.
Yeah, thanks. And I only looked at this, I was busy last night and this morning, so I haven't looked at it carefully, but it looked to me like I couldn't see in the tasks, are we reviewing draft reports and commenting on those? I wasn't clear from the charge. And then I thought it might be wise to put some responsibilities in that the council's expected to read the materials, but conversely, responsibilities on the staff to get materials out at least a week in advance. Or
Yep.
some period of time, whatever people think is appropriate.
Yep, I'm happy to add that. and happy to take whatever timeline folks would like. I like a hard deadline, so I work well under those. I will let's say a week, and if folks have other thoughts, they can raise those. But yes, happy to add materials sent a week in advance. And that members will commit to reading before the meeting. Are there other sort of rules for participation, attendance that you would flag, or other members of the group would have in mind in terms of kind of how people engage in the room? I do know I saw some documents that other groups have created that are much less formal, more like rules for our conversation, use I terms, some things like that. And I didn't include in this structure just because it felt a little disjointed. But if there's anything else sort of formal like that we would want to incorporate, happy to make other additions. Katie, I see your hand up.
Thanks. One question I have is the role of this group as it relates to any legislation or positions that the office may want to take in the legislature.
Yeah, that's a great question. Actually, I should go back to Trish, your first question, because I think they're connected. I did try in the charge and responsibility section to outline broadly sort of my thinking about what the relationship would look like. And that is that I would bring significant work product, concepts, ideas, to these meetings myself. So would certainly be requesting agenda items to give updates on, to your point, Trish, things like legislative reports. As well as less formal work product, though. I don't think it would necessarily be limited to only if the office is publishing something. I think, we may want to just have discussions about other things that are happening in the policy space here or elsewhere. So that one component is that I would bring those ideas, concepts, work products to the group and solicit feedback on them. I think I see that feedback coming in two levels: informal, where everyone is sort of speaking on their own behalf, and it's just an exchange of ideas that can help to inform the office's work, and then formal feedback, where the council, probably sort of at the discretion or in collaboration with the chair, would determine this is a formal decision that we really want to put on the record. We want to have a sort of unified decision of the council. And that's where the legislation piece comes in, Katie, for example. I could imagine the council maybe wanting to say, we are endorsing a position of the office or endorsing a piece of legislation that the office is suggesting in the future, like at the discretion of the group. I will say in that that first authorities section, from my read of the statute, I don't think that the office is compelled to accept the recommendations of this group. It is an advisory council, not a board. So I wouldn't be bound by a decision of the council, but certainly I think there is weight behind that. So my hope would be, that we could collaborate in those informal settings in a way that would allow us formally to make decisions and be on the same page. But those are sort of the two levels of feedback and how I would imagine interactions on formal decisions like legislation, or, Trish, to your point, legislative reports, being handled by the group. Does that answer your question?
It does. Yes, thank you. And I just I got a text from Mallory, and their power went out, so she's not able to connect.
Okay, thank you for the update. I was just hearing in the room before that there were some power outages, so hopefully she's back online soon. Great. Okay, well, in that case, why don't I hold, I certainly want to make sure that folks have time to read and reflect on that document. So why don't we take the time, bring it back up at the next meeting that we have coming up in October. I would say, I think if folks have big ideas, this would be a helpful area to maybe engage a bit via email between now and then if there's language suggestions. And then hopefully our goal can be raise the document again at the October meeting and accept it. I will say, from what I've seen, these are typically kind of living documents. And so I think I put in a provision about reviewing annually where updates could be made. So it's not a one and done, but more just some rules of the road for us for the next year. So moving on, the next topic that I had was connecting and talking a bit about these two special meetings that we have coming up. I'm calling them special meetings to be clear. They're not meetings of the advisory council. They are meetings that the office is planning. The first of those is a public hearing in September. That's statutorily required to take place before October 1st of each year. It is intended to be focused on cost trends and barriers to healthcare affordability, at least as of this year. I'm planning on holding that on Wednesday, September 27th at 9 a.m. I'd like to just lock in a date because I know for a public meeting like this that date is coming up quickly. Somehow the transition from July into August always makes the summer feel like it's flying by. A few notes on my sort of vision for the structure of this meeting. I'm imagining presenting myself on health spending. I think the focus of that presentation would be on the MHDO baseline report. I have been talking quite a bit with Karen Lee Harrington over at MHDO over the past several weeks about this work and other potential projects. And we're hoping that it may be possible to do a refresh of the commercial and Medicaid data in that report before the hearing in September. Certainly not committing them or suggesting that is necessarily possible, but we have been discussing it. And I know they're looking to see if that might be something that they're able to do so that we'd have something a little bit new to present as part of that event. And then would like to do some inclusion of the survey data. I know that Cake had been working, I think, with Altarum and has some pretty fresh and new survey data from consumers that was mentioned at our last advisory council meeting that I think is a nice way to get at that secondary question about what are barriers to affordability for consumers. So I'd be presenting that myself for potentially in collaboration with MHDO. The public is invited, and I think a major component of this process is inviting and allowing the public to testify in person. My thinking would be we'll allow in-person testimony or the submission of written testimony, but not virtual testimony. I'll just say very transparently, it's difficult to manage all that, and I anticipate I will probably still be the only staff member at that time, and I think we'll give lots of notice so folks can come in person if they'd like to, and this is a little different than legislative committees where things move around. I think it's pretty solidly scheduled. So that is my thinking, but welcome feedback on that if there's, aspects of accessibility that I should be thinking of there. I would plan to make the hearing available to view remotely, if not to participate in, just so folks can see what individuals are saying and be able to view the presentation. And then as usual in these sorts of settings, we'll determine a time limit for commenters based on the number of individuals who sign up. Then the last and biggest component is I would like to create sort of a structured format for feedback and comment. I don't think there's a way to, nor would I necessarily want to require that any testimony be provided in that structure. I think especially for consumers, want to be as welcoming as possible and make the process as easy for them as possible. But I do think that will really help to make the commentary useful to the office. It'll be much easier to compare across organizations and sort of collate that and think about it holistically as opposed to long individual letters that may be touching on very different subjects. So I say all of that to say I did include a draft of some short questions that I'd love to get feedback on from this group and recommendations on. I ended up splitting that into kind of 3 sections of commenter types. The first is providers, payers, kind of folks in the industry who are likely thinking about this from a specific kind of business perspective and specific constituency perspective. One for members of the public that's much more focused on individual experience. I did specifically in that consumer section ask for some feedback on assistance that they accessed and help with navigating the experience of struggling with costs. There is some language in the office's statute around proposing ways to help consumers to navigate and provide assistance through government programs. So I'd like to kind of hear if people have feedback on that experience. And then the final section is kind of for advocacy organizations, maybe brokers, other stakeholders who maybe aren't working in provider or a peer setting, but would like to comment. So it's a little imperfect. Obviously, it would be nice to kind of do customized questions for everybody, but I was trying to strike a balance between specific enough to kind of get it at certain angles and perspectives, but broad enough that we don't have 50 questionnaires out there. So kept it on the shorter side. The last thing I'll say is took some inspiration for this from the Massachusetts Health Cost Commission. They have a process where they require, I believe, their peers and providers to submit testimony before they have their annual meeting using a similar kind of format. And I took some inspiration for some of the questions, especially in that first section from them. So we'll pause there. Would love thoughts on this one. Yep, Trish.
Well, before we get into the substance, this actually begs a question back to the charter, I think. And that is, Trevor, I think it was Trevor noted that on this council, we try to rise above our own sort of special interests to think about the state as a whole. But how do you see the role of the advisory council here? And I know I have a conflict that day, but how, particularly when a number of our members are likely to speak, represent, given their professional responsibilities. So I think it begs the question of clarity about your role on this council, your role representing your constituency, and can we really expect people to do anything more than represent those constituencies on this group? I think it just raises some bigger questions for us.
I want to some extent, I think, defer to other members, I guess, but one thought I have, Trish, is that I think a helpful distinction is, in a format like that where there is a solicitation of input broadly from others in the same field as members, they can comment on behalf of their organization very clearly in their role representing that organization. Whereas, when we're in this room and when they are acting in their capacity as members of the council, that they try to take that hat off and sort of think from a broader perspective and with a slightly different angle. I agree. I think it's a tricky one. And I'm sure many of you have navigated this in other settings before, which is why I would love to hear from others. But I guess that's what I would envision and the line that I would try to encourage folks to walk, I guess.
Yep. My point was just be clear in our charter so we don't get crosswise later.
Yep. Anne Graham, I think I see your hand up.
Yeah, thank you. Thanks so much. I would suggest that we kind of follow the format of the meeting as we do when we have legislative hearings, and having people submit written testimony beforehand, and then allow them a 3-minute time clock. I mean, I was somewhat spoiled by having a highly functional HHS committee, and things went really well. And my concern is if we don't kind of keep some structure to it, we could get off the rails a little bit. So that's just my suggestion for the format of the meeting.
Thank you. Appreciate that. Yeah, and completely agree. I think we will encourage folks to, provide all the detail they would like in their written testimony. But when they stand up, try to provide the top line, the summary, what are the most important points, rather than getting up and reading through the full document. Certainly, given that we'll accept written testimony without the individual coming in person, I'm going to be reading through all of that, and I'm sure trying to think about how to gather it together and draw some conclusions or takeaways. So I think we can reassure folks, the written testimony will be taken very seriously and fully absorbed. Everything doesn't need to be said out loud, but I do think that opportunity for, some interaction in the room, I will say, I kind of look forward. I would envision maybe asking some follow-up questions from folks if they are testifying in person, and that some of that interaction back and forth might be just a nice forum to kind of advance some points or better understand the perspectives of a pretty wide group of stakeholders.
Apologies if you said this already, but is it an open-ended meeting? It goes for as long as it goes?
Yeah. Would be my plan, which is why I thought we'll do a 9 a.m. start time just in case. It's challenging with a new office like this. I've done some public hearings on rules at HHS, but without a lot of participants, but a little more under the radar. And certainly with this meeting notice going out to the HCIFS listserv, quite a bit more interest. So just a little bit hard to gauge, I think, how many folks might want to come, which is why I do think I'll ask for pre-registration so that I can get an idea of what the volume looks like, and then maybe give people 5 minutes if it's not going to take us too long, or kind of down to 3 or 2 if we feel like we need to. The last piece I'll say, Trish, just came to mind from your comment about the role of the advisory council. I will say I thought a little bit about, should this be a hearing where the advisory council is, you know, listening to feedback, but I think for the reason you raised, that might be a little bit difficult, and ultimately just reading sort of the statute and the requirements, I do see this as a function of the office. So wouldn't anticipate the council. Obviously, I assume many members will want to attend. I know some are not able to because they will be away and traveling, some to other interesting events on this topic, but you know, that's why we'll record it. I think folks will want to hear that, but it wouldn't be sort of all of us sitting and taking it in. I think, you know, the office will kind of be the convener and organizer as opposed to the office and council together. Kate, I see your hand up.
Thanks. I just had a question around, you know, sometimes people who can't attend in person, in other situations, like other types of hearings or public meetings might ask to have somebody else who is able to be there in person read their testimony. Is that something that's permitted, or will it just be written at that point?
I'm completely fine with that. I think as long as people are making clear when they start the testimony, sort of who it's being read on behalf of, which I can think about, you know, making sure that that's something that we ask everyone to do at the beginning, is introduce themselves and make clear who it is that they're speaking on behalf of, whether it's themselves or an organization. But yeah, I would be totally comfortable with that. As I said, really the remote participation piece is a little bit more around my concern about that being functional and managing it and making sure that we don't have, you know, Zoom bombing type of activities going on, as opposed to not, you know, wanting to try to make this as accessible as possible. That's something that maybe in the future I'd love to be able to make happen when there's a little bit more support and more hands to help with it. So I outside of that, and like I said, I mean, depending on opinions, I think we could do that if folks felt really strongly, but would love to do as much as we can to make this accessible. And I think particularly, it's always tricky, right? There's folks whose job it is, many of us in this group, to be part of these meetings, to come, to present, to speak. But I know for consumers, you know, that's not so easy, and a little bit harder for them to be aware of these things and feel comfortable, which is part of why I'm hoping maybe that question format is actually helpful, because it doesn't feel quite as much like, oh, I'm just looking at a blank piece of paper. But any ideas that you think in particular, Kate, would help individual constituencies, or I'll open it up and say businesses too, you know, some of the important, I think, stakeholders of this office's work, but who aren't engaged in it necessarily professionally. I would really love ideas about how to spread the word to them, make them aware, and encourage them to submit comments as well. I think I saw Katie's hand up. Oh, sorry, go ahead, Kate.
Well, just kind of on that as well, for people who do come live, I would just, if there is a time limit, something that's come up in other settings is if there's a language barrier, ensuring that if somebody needs interpretation, that doesn't count towards their time limit. It's just something to think about.
That's a great point. Yeah, thank you. I will note that down and make sure that we include that. It's a good point too. I will admit, I hadn't necessarily thought, but I'll make sure that in the registration form, we have people indicate if they might need translation assistance, because it's not something I have quite as quick access to as others. So we'll make sure there's a way to flag that in advance so that we can line that
up. This is Katie. I have a quick question related to this, which is, you mentioned the Consumers for Affordable Healthcare data as well as MHDO data, and your survey questions that you were working on. And I'm curious as to whether you anticipate providing those data to the public prior to the hearing so that people have something to react to, or are you simply thinking that people will sort of just speak more broadly about their experiences related to cost and affordability?
It's a great question. I think there is a little bit of tension there between trying to, sorry, I just have another participant, wanting to potentially include the update to the data, which would push us a little bit closer to kind of finalizing that presentation a little closer to the event, and versus, you know, having it out early. So I did give some thought to that. And I think it's a fundamental question probably about the solicitation of comment. I did focus the comment questions more around the experience of the organization, a little bit more around those questions of what are the barriers? What are you working on? How can we be helpful? You know, what policy change would you like to see, as opposed to kind of what are feedback on the data presentation? But I do think there's room for comment on both. So I guess what I would say is I will anticipate making the data public before the meeting. But I don't know that we're going to be able to do it way in advance, just because of the timeline to get it done. I think in future years, you know, I'd love to like move to a cadence where that we have sort of a regular schedule for a data release and then the presentation and public hearing on it. But just this year, as we're kind of getting off the ground, I don't know that we'll have a huge amount of lead time, but I think we could probably say a week out from the meeting to target to make that public, so that if folks would like to take a look through and provide any comment on that, they have the opportunity to.
Thanks.
On the data, you said you're hoping to update it before the meeting. Can you tell me what the effective date of the data would be before updating, and what data would be added to that?
Yeah, the goal would be, and again, this is tentative. I don't want to put the MHDO team on the hook for this, but the perfect world would be data, I think, for the first 2 quarters of calendar year 2022 for Medicaid and commercial. The Medicare data we're on a federal release schedule for, so that won't be available, unfortunately, but we could do that component, which I think is, you know, those are the areas I think of most interest here, given that we're not talking generally about Medicare policy. But yeah, so it would be an update there. I think I will say, in thinking about the data update, I've gone back and forth a little bit. You know, I think having 2020 and 2021 be the latest years is challenging, because it was the drop in utilization from COVID and then the bounce back. And so I am interested to see if we see a leveling off or a reduction in utilization in those early months of 2022, or if we're kind of still seeing the same sort of trajectory that there was in 21, which is why I've sort of been wanting to feel that out, because I think it would be an addition to the conversation, even if it's just focused on, you know, that 6 months. Any other feedback from council members? This is another item. I mean, I'm certainly going to be finalizing the comment form, but maybe I can make it a to-do item coming out of this meeting, and give folks a few weeks to maybe look that over and brainstorm a little bit and let me know if there are additions. And then I will plan to finalize around the very beginning of September, to be able to send that out to the interested parties, to give them several weeks to be able to fill it in and respond. If that makes sense.
I think that would be great.
Great. Anything else on the September meeting? Okay, move on. Looking forward to having that opportunity, though, especially it was an interesting process to sit down and write the questions and kind of think about how can we format this in the way that hopefully we'll get some information that we can you know, gather together and really learn something from. So excited about that opportunity. Next item to discuss, if I can get my slides to move forward, is the November convening. This is something that we chatted a bit about at the last meeting, this sort of vision for gathering together members of the advisory council and potentially interested legislators. I'm being selected representatives from the executive branch as well, for kind of a full day session of learning and thinking about some of the work happening around the country and from folks that have been engaging in this work, just as a way of really creating some food for thought. That's the term that I'm liking to use right now. And looking at calendars, tentatively thinking about the week of November 13th for this. That's pretty well in advance of the Thanksgiving holiday, but the week after we have Veterans Day. So I think it may be, you know, a good week for it, but haven't landed an exact date and time for this. Would envision it being in Portland, because the goal would be to do this in person and to invite in some guest speakers from other states. So trying to make it as easy as possible for them to fly in and make it to a meeting venue. As I said, I wanted to kind of reiterate that the goal is really a forum for stakeholders of the office to learn about relevant work on affordability, and especially from other states. I've found it really valuable to have meetings and conferences and events where I get to engage with sort of peers in other states, some of whom are advanced in working on some concepts to advance affordability, and get a chance to hear from them, you know, why they went the direction that they did, how things are going, what their recommendations and advice would be. Definitely acknowledge, you know, it's not possible to have a one-day meeting and cover every possible policy concept here or idea. So as I was brainstorming the agenda, I tried to think about kind of a set of different concept areas, goal areas, and a few of the big ideas that feel most significant, you know, that are getting attention, that have the potential to make pretty big differences, pretty big impacts, and kind of present a cross-section of that. Wanted to be very clear, you know, this is not an endorsement of those policies, not saying that this is a menu and we're going to pick one and run with it or anything at all along those lines. It truly is just something to spark conversation. I think, as I said in the first meeting, it's a very broad charge that this office has. And I think being able to look at what other states are doing makes it a little bit more tangible, gives us something to react to think about what would it look like and mean to pursue similar policies or some version of them. But by no means saying that all of these are a great idea or would work well in Maine. And then finally, just a quick note, I would sort of envision that this would be something where attendees would be asked to review reading materials in advance so that the panels could really jump into the meat and the hard questions and the conversation and discussion, rather than kind of being a one-on-one of here's what the policy is. I've got a agenda on the next slide that I think probably will want to spend quite a bit of time discussing or have some back and forth on, but we'll pause there. Katie, I see that you've got your hand up.
Thanks. I think that sounds like a great day. And I would ask, as I guess, I don't know if you're going to be open to having us submit suggestions to you regarding speakers, but I think it's really important as we think about other states to look at the demographics of other states as well as just the activity occurring in other states, because the demographics really can influence what is possible or what how policies will turn out, or how they will be implemented effectively. So just a suggestion.
Yeah, I will say, Katie, I didn't include specific speaker thoughts on the next slide, in part because having organized similar events like this, I think it's going to be a moving target. You know, a lot of it is going to be who's available and willing and able to come. So I don't want to get too locked in on, you know, here's the 3 people we want for each panel, because I have the feeling we'll need to make changes and adjust. That being said, I definitely, you know, pulled from folks that I've encountered at conferences or work that I know about that's happening. And so I'm very open to ideas or suggestions about other states or even other individuals if you know someone who's a great speaker and doing something exciting. But the one thing I will also note, maybe I'll just move right to the agenda to say this. I think several of the initiatives or ideas that I was thinking about for conversation tend to be sort of unique to a state. You know, a lot of this is a little bit more cutting edge work and a little bit of frontier blazing. So sometimes I picked a state based on it sort of being the one that is doing work in one particular area or exploring one particular model, even if demographically it would have some differences from us. But I think that that's good fodder for conversation in the room. And again, why I'm, you know, not by any means trying to say like these are all models that work well here. I think some of what we talk about and take away might be that there are very specific characteristics of a state that have made a model that they've pursued work for them in ways that it wouldn't for us here in Maine. But I would say there's also value in learning that, because I often, you know, will hear mention of what one state is doing and may know from behind the scenes that there are reasons why that might be more challenging here. So I would kind of include that as, you know, even if it's crossing some policies off the list or saying like, oh, that's one's maybe not as feasible here in Maine, as like a positive, productive, useful outcome of the meeting, if that makes sense.
Great, thank you.
Anne?
Yeah, so to that point, I had shared with Meg earlier that the speaker has asked myself and Representative Holly Stover to attend a healthcare cost conference put on by NCSL in Chicago on September 27th. So I won't be at the September meeting, but I certainly may be meeting a whole bunch of people who have great programs happening in their states. And so I guess the question to you, Meg, is, if there are individuals that, Holly and I really connect with and feel like they would make a difference, would they be able, is that enough lead time for them to be able to come and present in November?
Yeah, I would say maybe we could keep in touch about that. I am envisioning that following conversation with this group and feeling like we've got the agenda sketched out the way we'd like. I am hoping sooner rather than later to start putting feelers out to folks, just again, recognizing that if we're asking for travel, that adds an extra layer of complexity. But as I said, I also imagine I will probably approach some folks who won't be able to make it, and this will be evolving over time. So I would say if we could, maybe check in before you head to that conference on the status of things, and then chat again after you've had a chance to meet folks. Would definitely welcome recommendations, and especially when there's that kind of in-person connection, I think it can foster a little bit more willingness maybe to come in and speak to the group. So we'll just say that I think over time I'll see where things are landing, but I wouldn't be at all surprised, despite my best efforts, if maybe we still have some openings in the groups at that point.
Excellent. Thank you.
And I also will mention one item, not confirmed yet, but I have been having some conversations and anticipate we may be able to have some foundation support for this event. So we'd be able to offer coverage of travel, or at least a stipend to folks, because I know from personal experience, it's great. Some of the folks at think tanks or universities traveling and coming and speaking at events is a part of what they budget for, but I know other state officials or legislators don't have easy access to be able to do that. So not 100%, but I am fairly confident that that's something we'll be able to do to make this a little bit more of a realistic event to pull together. Trish, I saw your hand is up.
Well, probably won't surprise you, but I would strongly encourage you to work closely with the National Academy, my former organization, full disclosure, the National Academy for State Health Policy. They're in Portland. They have a cost center that works with every single state working on cost containment, and I would value their perspectives on this. They also have funding and may be able to help. And to that end, they also have what I know among the hospitals is a controversial initiative, but it's a hospital cost tool that they've developed with Rice University that many, many states are using. And I would be very interested in having that presented with Maine data and with the Maine Hospital Association and NASHB to sort of get a sense of what that tool tells us, given the huge impact of hospital costs on healthcare costs. And again, I would want it to be balanced. I don't fully know sort of how it's been implemented lately.
Thanks for that recommendation. Yes, definitely want to chat with the NASHP team. I'm going to be down at the conference next week, so I'm seeing Maureen and others. And I will say, I envision this, maybe I would moderate one of the panels. Definitely I'll welcome and do our closing, but I would anticipate asking some folks to come in and maybe moderate for us. I can definitely imagine someone from NASHP being a great fit for one of these panels in that role as well. And I will give some thought. I think it's a great point. There's a lot that could be covered in the data section as usual, and as we discussed at the last meeting. So thinking about whether there's a way to either fit that into that panel, or if we'd want to separate that out and do a few sort of shorter panels in that opening section with a few different angles, as opposed to kind of one big data review panel. I will definitely give that some thought.
I think it would be nice, I don't know if you're planning on doing this, but to, I'm guessing you're not going to be able to cover all the wide variety of strategies that exist out there. So some sort of supporting menu, just so we're not fixated on just the things that are brought up during this meeting, but have a variety of potential strategies to consider in this group would be great.
Yep, that's a great thought. We can make that part of the pre-reading, some kind of table maybe.
Yeah, like Catalyst for Payment Reform has produced a report on potential state policies to address costs that I thought was a really good sort of broad view the buckets that you could look at, the levers you could look at from a policy perspective.
Yeah, that's feels like a great opportunity to maybe do some of that pre-reading before this meeting. So definitely, I know the report that you're talking about, and there's a couple others that I can think of that have come out over the last year or so. And so in addition to maybe some short, what I'm imagining, maybe one pagers on some of the specific state policy initiatives that would be presented, we could also do a sort of packet of some background reading as
Yeah,
well.
and that might be something that NASHB could even provide. I think Trish's idea of having someone from NASHB participate in some way is a really good one.
Yeah, I will say I thought a little bit about maybe a panel on like lay of the land with some of those
Yeah.
perspectives, but it's hard to fit things in if people want to be able to have a break for lunch at all or,
Right, so week-long conference.
exactly. Yeah, I could plan one. I'm sure it would be fun, but yeah, just had to try to figure out prioritization. But I like the idea of doing that in reading in advance because that feels like a good way.
But it may be Trevor might be onto something. It might be a way to open, if you think about restructuring this a bit, to open it so that people have the full panoply of options and sort of the pros and cons, sort of a context to think about what might work in Maine. Might be a really interesting way to kick this off so that there's a whole horizon of opportunities and we focused on just some of them.
Yeah, I think that kind of the structure you have here in the agenda where you have sort of marketplace strategies, delivery system strategies, if you could bucket them sort of in these different areas, just to make them a little bit more digestible, I think would be helpful.
That was the goal. I know there's some other hands up, but just to close out that thought, curious, Trish, for your take or Trevor, in terms of that suggestion, would it be your recommendation maybe essentially shorten some of these panels up, or would you do a swap in or out? Because again, that's the challenge for me. And I did think these are some big topics, right? This isn't a panel where it's 3 states all pursuing the same policy, discussing with each other. There's some really big ideas here. So my instinct had been, let's make these like an hour and a half so we can do an hour of panel and 30 of questions. But I'm just curious if that would be a recommendation, maybe shorten them a little bit and add in that level setting, lay of the land section at the beginning.
I wonder if the panel on addressing the role of provider prices and consumer affordability might be able to be addressed in that first panel where you're reviewing the data to free up some time.
That's a good thought. Yep.
I also think how you do this, obviously I've had a fair amount of experience. It might be, I found useful have an active moderator who pegs questions that are make it look like an interview. Do it very quickly, then open it up for questions, because that really gets to instead of the talking head approach, that really gets to the engagement and the focus on what Maine people want to hear, the stakeholders in Maine. And I think that's a really successful strategy because people can always read about an initiative, and no matter how good a speaker is, it's a little deadly to sort of hear the nah, 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 and then we did this. And if you tighten the presentation and open it quickly to questions, or even moderator questions, it's more lively and it gets to the core of what stakeholders want to hear, I think.
Yeah, I totally agree with you. I will say, I didn't say this explicitly, but I personally like that model too, where maybe everyone gets like 3 minutes to do an intro, but then it goes right into panelist questions. I think I had leaned a little bit more towards giving more time for panelist discussion. Again, definitely don't anticipate presentations with slides. I think the conversation, but it's a trade-off, right? I think that the conversation between the individuals pursuing these strategies can sometimes be pretty engaging and interesting. So I would hate to cut that too short, but maybe a balance where we try to do a 40-30 or something like that could work. And I do agree. I definitely would like to prioritize making sure there's good chunks of Q&A time. So it's not just 1 or 2 questions at the end, and there's some good opportunity for interaction.
Yeah. I think my point is if you had a moderator asking questions of the panel, you get more engaged panel and then turn to the public at some point.
Yeah. Want to check in with Jeff. I saw that you've got your hand up, Jeff, and then we'll go to you, Katie.
Yep, thanks, Mike. So, the panel under reforming delivery system, CMS's innovation arm, CMMI, has done a lot of work in the primary care space. And there's a boatload of practices in Maine that are participating in one of the models, but they just recently published what I would call a white paper, but I guess in modern terms, it's a blog post. So anyway, they've got a new model coming out, and they are really focused on getting multi-payer participation. So that it might be worth reaching out to them, and certainly MaineCare is playing in the space as well. So I think plenty of interest in how primary care can play a stronger role in our healthcare delivery system going forward.
Yeah, that's great feedback. Thank you, Jeff. And you beat me to the punch a little bit there. I was going to flag that CMMI at the beginning of the year, I think in a speech or a post, Liz Fowler had indicated they'll be releasing a new multi-payer model sometime this year. So I don't know when that will be, but I'm thinking maybe if the meeting is in November. Having worked at CMS, I do know that sometimes by the end of this year, it means like December 31st. But if that is out or if they're able to talk about it, I think that having a representative of CMMI on that panel potentially could be really interesting. So definitely something I want to pursue, and we may just need to adjust based on whether or not, there's more information about that they can either formally share or willing to come in and give sort of a preview of. But yeah, I think that could be a really interesting opportunity for kind of many of the right folks to hear and engage with them. And then the other quick thing I was just going to add was, I do think there's a few initiatives, particularly Rhode Island. They have a health affordability standard program, which sounds like focus only on affordability, but it is really interesting in his sense of taking a more holistic view, where they've been, taking some steps to really prioritize and set state level targets for participation in alternative payment models for primary care. So even think about that next level beyond of are there broader multi-payer government involved efforts to kind of take the existing work and enhance it, supercharge, expand, was kind of what I was getting at with that item on the possibility list.
Yeah, their newest primary care model, and I only remember the acronym MCP, because it's such a goofy acronym, I can't remember the actual name. That is not going to be applicable for the state of Maine. But what's interesting about that model is where CMMI's thinking is going forward. The other model that they just announced probably 10 days ago was around supporting dementia patients. So that might be of interest as well. But I will send you the white paper that they talk about, that MCP model. But what's interesting about it, more than anything from my perspective, and value-based care, is what they're thinking sort of down the road. And so I'll send that over to you, Meg.
Yeah, that would be great. And I do, making care primary, I believe.
Yes,
is
that's it.
The title, yeah. There's
Making
always some
care
combination of primary care and making, yeah.
And they're running out
I
of.
agree, it doesn't roll off the tongue, that one.
No, it doesn't. Yeah, no, thank you for that.
Thanks. Katie, did you still want to share a thought?
Yeah, thank you. Yes, I just, I don't see here anything related to cost shifting and the role that plays in the affordability context. And I think that's really important. So I would ask that be included. It might be under the provider price component. It might be, we really do, as we discussed at the first meeting, we need to segment out governmental payers from commercial payers. There is a big distinction there. And so we need, I think, very important that we cover that component at some point in this conversation.
Yeah, I would say I would envision that being part of the data conversation, and to Trevor's point, if we think about maybe combining those, the distinction doesn't matter too much, but I would anticipate a discussion of that in terms of the body of evidence and data around drivers of health spending. And I also will say I am still working, I think, on my discipline about being very clear about markets when I'm referring to them. I think in that panel around addressing the role of provider prices or talking about provider prices in that context, I am thinking specifically commercial. Still definitely understand, your point about the interplay there, but that would really be the focus of that section of the agenda.
I think that really is.
I appreciate that. And I feel I want to make sure that we do not focus solely, I think that intersection is critical. And it gets back to my point earlier about demographics of the state. We look different than Rhode Island. We look different than Massachusetts. And we look much more similar to, say, West Virginia, which isn't anywhere. And Trish will remember that, I think, because that was always our comparison state in the Dirigo days. So I don't in any way want to suggest that we shouldn't be looking at innovation that's occurring in other states. I think we absolutely need to do that. And we need to do that in the context of this state, the infrastructure that we have and the demographics that we have. So that should be woven into all of these conversations.
Yeah, understood. I do think I'd be interested in the conversation about trying to establish, corollary state. I guess my feeling and perspective is every state is really different in terms of those demographics. Definitely understand in terms of, level of poverty or enrollment in public programs. I'd point to New Mexico that's on the other end of that spectrum, where I think at the moment they've got more than half of their population enrolled in Medicaid. And, states that might have a higher income population might also have a more significant population of people ineligible for health insurance because of immigration status, for example. So I hear you on that, but I also just want to be careful that we're not trying too hard to find a corollary and focus only on that, because I think you could argue even regionally in our state, right, we're going to run into differences. So again, that's why I guess I see weaving that perspective into the conversations. And to your point, I think it's a good lens to put onto it and make sure that we're consistently going back to when we're talking about the details of a policy or the rationale behind it, differences from state to state. But I sort of don't want to limit ourselves to saying there's one or two other states that we consider like us, or that, we can't learn from other states just because their demographics are different.
No, I totally agree with you. And I just want us to make sure we do use that lens, and that access to healthcare really needs to be a tenet that we all agree is a foundation. So, and it may look different in the future or different ways of providing access, but that really seems very important as a foundational point.
Yeah, I totally agree that we need to be considering the cost shift argument, but I think it would be interesting to hear from someone who studied it on really what that impact looks like, because there are national studies now that show there really is not a significant correlation between payer mix and price, and that may not be true for Maine, but understanding where the sort of body of evidence falls on that issue, I think would be really helpful.
Agree. Yeah.
When we're discussing demographics, I assume we're also including things like how rural or urban a state might be when we're making those comparisons.
Yeah, there are many lenses on it.
Yeah.
Income is one, rurality is one, age is one. That's always a big factor when we're looking at data here. So again, that's part of why I don't know that we have an exact match anywhere. We've got a lot of differences between ourselves and other states, and again, even within our state, I think.
It feels like this is an opportunity for us to sort of put everything out there and understand what's going on in the market, and then we can decide, at a later point in this group, what's applicable in Maine, what kind of caveats we need to put on any of these policies that we're considering for Maine. But yeah, I wouldn't want to get too bogged down in making sure we have one-to-one corollaries before taking any of these things into consideration.
Just making sure we're keeping those considerations
Sure,
as we look
absolutely.
at everything.
Yeah. Yeah, and that's why, again, I definitely do not expect anyone to walk out of this meeting and say, okay, I heard that Washington is doing that. That's what we're doing. Let's rate the bill. I see this as a place where we'll have opportunities coming out of the meeting among this council, and I hope among other participants as well, who I think are interested in getting more familiar or getting a chance to learn more, to, think about aspects that sound really promising, or ideas that are interesting that we hadn't considered, and thinking about, is there some combination of those or a twist on those that is worth further exploration here in Maine as well? Because obviously I think most of the concepts that I've listed here, these are very complex policies to implement. You know, these are not simple. There's a roadmap. There's a draft bill. All aspects would have to be, you know, customized to the state of Maine. So it's many, many, many steps away from, you know, really considering a proposal here. But again, in trying to think about how do we begin this conversation? You know, how do we get past just feeling like there are so many ideas and possible pathways forward? This felt like a way to just get us moving and give us something to respond to, basically. Are there other comments, thoughts on the agenda? Wonderful. Well, yeah, my plan will be to, over the next week or so, start thinking about getting some feelers out and chatting with folks who may be interested. And so again, this is an item where we don't need to close the book on discussion. I think if someone comes to mind for anyone, or if you have someone in mind now that you want to send over via email, I'm happy to consider recommendations about speakers or even other policy topics if I haven't listed them here and you think that they could be a fit. And my goal for this would, again, it's a little bit of a chicken or egg. I try to feel out availability a little bit among that week, but again, recognizing we'd have folks traveling, that this will be a big time commitment to take the full day. Would like to, you know, within September, hopefully the first few weeks of September, kind of lock in the date for this and kind of get a save the date out to the group. Moving on. I think the last item that I had on my agenda was just thinking briefly about future meetings. I will send the calendar invites out for these, but I had done a quick poll that a few folks responded to. I continue to struggle. I so badly want to find a time that everybody can make work, but I think I still might have one person who wasn't able to, but the third Tuesday of the month seemed like the greatest consensus time, and I did prioritize barriers and inability to attend over preference. So I know a few folks would have liked the morning, but there were some folks who couldn't make it at that time. So I stuck with afternoon. So looking at October 17th for a meeting, thinking that that could be an opportunity for the group to debrief from the public hearing. I'm happy to you know, consolidate some of the feedback and think about kind of a presentation of takeaways that we could discuss. And then I am thinking about that meeting also for an update on research questions and analyses. As I said, very excited that there are some resources to put towards analysis and have been having some bigger picture conversations with Maine Health Data Organization about work product they already have, their priorities, understanding a little bit better what some other state agencies are thinking about in terms of analysis, and would like to kind of come back. I know we did the presentation of what is the data that is existing, but I'd love to talk about, okay, what are the questions that we don't feel like we have answered well in data now, and what are the sources that we could pull from potentially to do some custom analysis that we think could really contribute to the mission of the office and advancing our goals. And then on the December 19th meeting, similarly, we'll be coming out of another big convening. It's going to be quite the cadence from September through January, probably, and then right into the legislature. So I figured that would be the forum where, after we've heard ideas, we could talk a little bit about what are next steps. You know, are there concepts that people are interested in talking more about, or would we want to invite some virtual speakers from other states on a particular topic to come in and just reflect on what we've heard and learned during that day. And then would also anticipate that being a forum to bring, I'm hoping drafts, but I wrote outline/drafts just in case I need a little extra time on any of them, but those legislative reports that are mandated. So one of those will be just sort of the annual report from the office that's primarily focused on a readout from the public hearing, but where I'll, you know, try to discuss some of the work just to establish the office. And then the other being, which has a slightly later due date, that study of public option models. So I would like to bring those and have an opportunity for the group to get sort of a preview of them, provide feedback before I finalize and submit. I thought I would pause there. I know it's a big question, and again, this doesn't have to be answered right now. I think we can communicate it between now and October, but would like to, you know, moving forward, make sure that I'm also responsive to the group's interests, and if there's any topic that you would like a deep dive on, or if there are items for conversation among the group that you're interested in, that we incorporate those in as well. So we'll just ask, again, no pressure. If there's nothing, I know we're only meeting today, but want to open up the floor if there are ideas about that for discussion with the group now, or again, certainly happy to kind of create a cadence. I think we'll start checking in, myself and the chair and vice chair, on a cadence in between the formal meetings to maybe check in on agenda items and make sure that if there's anything that has popped up, I have the opportunity to add that to the agenda as well. And given the pace of things, I won't commit that those are my only 2 items either. There may be new developments that I want to add on, but I wanted to at least, sketch out an idea of kind of what the remainder of the year look like in terms of the council meetings. Okay, great. Sounds good. It's meeting everyone's needs. That's wonderful. I will also say, I'm going to be coming back. The struggle around timing and really wanting to accommodate everyone if possible is why I was like, I'm going to commit to the dates for the remainder of 2023, but maybe we can chat about whether we'd like to open it up and see if we can do another kind of call for availability for 2024, and change the timing or stick with this. But folks can put those on their calendars. I'll send out meeting invites, as I said, either this afternoon or tomorrow, to get those times held so that we've got them well in advance. Okay, I think that was the last item on my agenda. Are there any other topics that folks would like to discuss? Anything else to raise? Yeah, Katie.
Hi, Meg. Sorry, I keep talking, but I think it would be interesting to get a picture of disease burden in Maine, by population, by geography. I'm not sure exactly what that might look like, but to the extent that disease burden is a demographic factor that drives cost, that would be helpful. Do we look the same from a disease burden perspective as the states to which we're comparing ourselves? And I think specifically, sorry?
Oh, so I was just asking if there's any publicly available clinical risk scores by state.
I'm sure that we could find, I'm sure that such data is available. We don't really have the public health perspective on this group to the same degree that we might, and that seems like an important aspect of this conversation.
Yeah, I was going to say, I don't know about risk score, but I think that CDC would have data along these lines. There's also some conclusions that can be drawn, I think, from MHTO data, but again, it's not going to be comprehensive. So probably going through something that more on the clinical side rather than the claim side is probably the better way to get at that. But I feel certain that I've seen some data along those lines. How possible it is to cut it by demographics, I will say that I'm not sure about. I think probably geographically and certainly at a state level we could do. I can't off the top of my head think about a source where you can think about disease and things like income level, for example, but I will take a look at that and see what I can find.
I do think claims data could be a place to start, because if you had Medicaid claims, for example, that would give you some level of information related to income, and we could look at that.
Yeah, and certainly for a certain common diagnoses, something like diabetes, I think that there are ways to take a look at the Medicaid and commercial data and draw some general conclusions. My hesitation is just, as I said, that we know on the commercial side, we're missing a bigger segment of the claims than we would be on the Medicaid side. And I would just want to think about whether there's any reason why the data that we do have wouldn't be representative of that population. So I will give that some more thought, but yep, I hear you on being able to at least draw some conclusions about income based on program eligibility and enrollment. Annie?
Yeah, just really quickly, I didn't know if just council members are to be speaking. I see that Jane Pringle has had her hand up several times, and I didn't know if individuals that are observing the council meeting are allowed to ask questions?
I would say, I think it's at the discretion of the council. I would say, I think if there's a desire to have like a public comment section of the agenda, we could certainly do that. I think my understanding was the meeting is open to the public for observation and for transparency, but that members of the public aren't, involved in the proceedings. But I'm happy to follow the group's lead on that. I'm not sure if it might be something that we want to hold on and have a conversation about and think about working into the charter, or if we want to say for today, we'll open it up. I defer.
I would suggest, just given that we're ahead on the agenda, that we could do it now. I do worry as an ongoing issue that if we're opening this to the public and they can ask comments, that it may sort of has the potential to derail conversations, but I have no problem right now.
Yeah, no, Trevor, I totally agree with you, with, open-ended public comment. And, so that, yeah, I would suggest that we put into our charter that, we allow public comment at the end of the meeting, as opposed to, ongoing, interaction and derailing our active conversation. So, yeah, I don't know. It's up, Trevor, you are our chair. I don't know if we want to, yeah, Katie's doing a thumbs up. If people want to do a thumbs up, or it's okay.
Yeah, I'm thumbs up on this.
Okay, great. I think I'll maybe do a one last call then. Do any advisory council members have any other items? If not, we can close out and go to public comment. Okay, great. I will need to take a minute because those who aren't members of the council are in a different sort of category here and aren't able to come off mute. So I'm just gonna take a look through. Making you a presenter. Jane, are you able to come off of mute now? If so, welcome you sharing your comment or question if you have one.
Thank you. Yes, I tried to see if there was a way to type in my question. It related to the simple question of where you will be holding your public hearing in September. I was an invitee to the meeting as a member of Health Coverage Insurance and Financial Services in the state legislature. But if there's a way in the system to even type in a question, I would have been happy to do that. And I was fine to wait. I appreciate Annie noticing and giving me the opportunity to ask where you plan to hold your public hearing in September.
Thank you for the patience. And yes, good question. I'm sorry that I didn't note that. Definitely here in Augusta. I haven't determined the room yet. My default is off in this room that we're in at 109 Capitol Street in Augusta, just because it's large and has a well-functioning audio video setup, but I was thinking about checking with the Department of Administrative and Financial Services and maybe seeing if there's somewhere a little bit more central to hold it, but definitely anticipating holding that here in Augusta just in terms of the central location and nature of the Capitol. So that'll be the plan. And when I send out the information, and I will say very much hoping that we have a website so that we can post the information there as well, so it's easily accessible by that point. We'll make sure that includes the specific building and room.
Great, thank you very much.
Are there any other members of the public attendees who would like to comment or ask a question? Maybe I'll briefly look over at the room here. It looks like we're good. If there's anyone else who's joining virtually, if you'd like to raise your hand, we can provide that opportunity. Okay, great. In that case, we are wrapping up a little bit early. Give everyone a little bit of time to drive home slowly, or the five of us here in the room a little time to drive home slowly. Thank you, though, to all of you joining. I know that this is a tricky time over the summer and that we've got some folks who dialed in from vacation and things like that. So we've made an extra effort to attend virtually. Really appreciate it. And looking forward to a very busy fall ahead for the office and seeing a lot of you. I will just briefly note, I do have a little bit of vacation time coming up starting next week. week. I'll be gone for a couple weeks and traveling, planning to take my phone with me and get the sign off from OIT to bring it along, since I don't have anyone else to put in my out of office email. So I'll be reachable during that time, but not, online all day, every day. So just a quick heads up about that. And then back in September and very busy from then on. So looking forward to it. Thank you again to all of you for your time. Great to see you. Have a great afternoon.